Okay, good night, everyone. Can you listen to me?
Yes, teacher.
Thank you. And can you watch my screen?
Yes.
Perfect. Okay, let's start with the second part of systems, diseases, and symptoms, okay? Jethro, can you read this part, please?
Yes, teacher. Good evening. Childhood. Milestones. Childhood is a period during which a person is a child. It ends with the puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestones in a child's development and the ages of which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months, talking, 2-word sentences by 3 years.
Okay, thank you so much. Okay, so we have here the milestones. Is childhood, when goes a period during which a person is a child. It ends with puberty, the onset of sexual maturity, okay? And infant is another word for a young child. We can say infancy is the period from birth until about 5 years of age. And the milestones in a child's development and the ages at which they usually occur are approximately, okay? Sitting by 9 months. And I'm pretty sure that some of you are gonna tell me if this is true, okay? Or if there is any variation on these numbers. Okay, we have the sitting by 9 months, crawling by 12 months, first words will occur by 18 months, walking by 18 months, and talking 2-word sentences by 3 years. Okay, and here, who's a family doctor here? I don't know, Rina maybe? Or Carla Bar?
Hello, teacher. No, I don't have relatives, doctor relatives.
Okay.
I don't have.
Okay, but someone were a family doctor here. Carla Barta, maybe?
No, miss. I am in the internship.
Okay. Well, I don't know if you are agree with these numbers. That this period occurs during the 9 months by for sitting in a child, or crawling by 12 months, or maybe after or before. I want to know if you agree with these numbers. In your experience. Nobody?
Maybe about walking around the 12 months, but if the baby don't walk in by 18 months, we can see what happened. We have a time for the baby for
Okay.
walking. We usually start at the year, but maybe can start at 8 months. I don't know.
Okay. And you think 18 months are too much?
Yes,
Okay.
but
It can,
can happen.
okay, it comes with a variation, right? Perfect.
Yes.
Thank you. Then, uh-oh. Okay, thank you. Melanie, can you read this part, please?
Yes, miss. Common infectious disease, disease and common name. Morbidly rubella, measles, rubella, German measles, varicella, chickenpox, infection, parotitis, mumps, pertussis, whooping cough, acute laryngotracheitis, croup, scarlatina, scarlet fever, rheumatic fever, tetanus, lockjaw, poliomyelitis, polio.
Okay, thank you. As we can see on the left side, we have the disease, the name of the disease, and on the right side, we have a common name. Okay, so morbidly or rubella, and the common name is measles. We have the rubella and the common name German measles. Varicella, the common name chickenpox. Infectious parotiditis, mumps, okay? Pertussis, we have whooping cough. Acute laryngotracheitis, we have the common name as a croup, okay? Scarlatina, we have the common name that it's gonna be scarlet fever. Another disease would be rheumatic fever, and the common name will be rheumatic fever too. Tetanus, lockjaw, and poliomyelitis, polio. Okay. We have another kind of diseases, and we have another names that can call commonly, but these are the most used. Okay, Jorge, can you read the left part, please?
Sure, okay. Celiac disease, some medical language note. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy, it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood.
Thank you. Okay, so we're gonna have some vocabulary here. Jorge, oh no, sorry. Mateo, can you read the right part, please?
Okay. Sensitivity to is having a negative reaction to. Weaning is changing the diet from milk only to solid foods. Clinical features is the symptoms and signs of a disease. Malabsorption is poor absorption. Malnutrition is poor diet or nutrition, or the adjective is malnourished. Thrive, grow strongly. Distension is swelling. Delayed is later than expected. failure, when something that is expected does not happen, and stature is size, especially height.
Thank you. So as you can see here, we have some words, right? And here we have the meanings. And here we can say malnutrition, and another adjective to say it is malnourished, okay? I don't know if it's clear here or you need some explanation.
I think it's clear.
Sorry?
I think it's clear.
Okay, thank you, Mateo. Perfect. Let's continue because this is a long topic. Okay. Rina, can you help me reading this part, please?
Okay. The endocrine system, excess and deficiency. An excess, too much, or deficiency, too little of circulating hormones causes a wide range of medical conditions. For example, hyperthyroidism and hyperthyroidism and hypothyroidism. Where there is an excess of hormone, one form of treatment consists of giving the patient something which inhibits the production of hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, maybe by replacement therapy, for example, injection of insulin in the treatment of type 1 diabetes.
Thank you. Okay, so as we know, an excess is too much, or deficiency is too little, okay? In this case of circulating hormones, cause a wide range of medical conditions, for example, hyperthyroidism or hypothyroidism, okay? Well, let's continue here. Valeria Mercado, are you here?
Yes, teacher, good evening.
Good evening, please. Can you read this part?
Yeah. The first word of the title is goitre,
Yeah, that's correct.
goitre. Okay. An enlarged thyroid gland is called a goitre. The enlargement may be diffuse, that is involving most of the gland, or localized, limited to a particular area, as in a solitary single nodule. The increased blood flow in diffuse enlargement, for example, in Graves' disease, may give rise to a palpable thrill, vibration felt with the hand, an audible breath, noise heard through a stethoscope over the gland.
Thank you. So the goitre will have a name in Latin America. Do you know which is the name?
Maybe bocio.
Bocio?
Yeah, that's the name. I don't know if in every country is the same name for this disease, or there is another name. Okay, I think it's the most common one to call goitre, right? Bossy. Okay, so is there any word that you can not understand? Okay, I think it's pretty clear, right? Well, here we have a letter of referral, okay? I want Andres, please, to read this part. Can you?
Sure, teacher. A letter of referral. Mr. Davis' doctor has referred her to an endocrinologist. Dear doctor, I will be grateful if you will see this 60 years old woman who has lost 20 kilos in weight in spite of eating more than usual. She described herself as overreactive. Overreactive is more active than that is usual. And at first, she thought the weight loss has due to this, but more recently, she has developed palpitations. Palpitations are awareness of rapid or irregular heartbeat. Uh, diar- Diarrhea and heat intolerance. Heat intolerance is inability to cope with high temperatures. Her symptoms suggest hyperthyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, red sweaty palms, and a fine tremor. Fire tremor is very slim, involuntary movements of the head.
Okay, thank you. And we have this letter. I don't know if you think we can add something else, or you think something is not good to put on a letter of referral, or maybe it has another kind of or a variation here on Latin America. Okay. Well, dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive. What does it mean? Overactive means more active than is usual. Okay, and at first she thought the weight loss was due to this, but more recently she has developed palpitations. What are palpitations? Awareness of rapid or irregular heartbeats. We have diarrhea and heat intolerance. What does it mean? Inability to cope with high temperatures. Okay? She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism. And this was confirmed by my examination, which revealed an enlargement and enlarged thyroid, red sweaty palms, and a fine tremor. What does it mean, a fine tremor? Very slight involuntary movements of the hands, okay? I don't know if you think that we should add something else. Or is the same kind of letter that we use on this side of the world? Have you ever made a referral letter?
I
No?
think that references here in Bolivia, at least, are way too different from this. You know, you have a form, you have to fill a form with the patient's information, just like the name, age, and all that stuff, and symptoms and clinic presentation, so the other physician can examine the patient with a base, right? But there are no, I don't know. I think there's no such thing as a letter of referral, like in this case.
Okay, you mean we don't do or we don't make a personal letter to our colleagues, right? There's just a form. We put the information, the things we think the patient will need, and that's all, right?
Yeah.
Okay.
It's not that formal like this.
Okay. Thank you. Well, let's continue there. Well, here we're going to start to talk about some parts and some specialties, okay? We have the eye and the parts. We call here this part the eyelid, sorry, the iris, okay? Eyelashes. We have here the pupil, this here in the middle, and the eyebrow up here. When we make an examination of the eye, we will say, Carla, Barta, can you read this part, please?
Okay, Miss. Look for a skin strabismus, drooping of the upper lid, ptosis, or oscillation of the eye, nystagmus in light lack. The upper eyelid moves regularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size, they are regular in outline, evenly circular, they are abnormally dilated, large, or constricted, small. They react normally to light and accommodation, focus on near objects. To test the reaction to accommodation, ask the patient to look into the distance, hold your finger in front of their nose, and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also for the cataract opacity of the lens.
Thank you. Okay. We can check, we can look for some signs, right? And we will, when we make the examination, we will see if they are equal in size, if they are regular in outline or evenly circular. Maybe they have another form. They are, if they are abnormally dilated or large or constricted, small. If they react normally to light and accommodation that is focused on near objects, okay? To test the reaction to accommodation, we ask the patient to look into the distance. Hold your finger in front of their nose and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also for cataract, that is the opacity of the lens, okay? Do you think those are the most detailed things we can make on the examination, or maybe we missed something. I know this is an specialty, right? But maybe you read something or watch any colleague now or any doctor or professor made this, maybe. Go ahead. Can you repeat it?
Yes, I think that is the first part of the examination of the eye. Yes, it's the same. I think it's the same. It's the same order that all examination of the eye is required. It requires to describe in the Historia Clínica. And after that, I think that is used, no, that is the another part of the examination is using the ophthalmoscopy. I think that is the name, ophthalmoscopio.
Okay.
Yeah, with the when I use the ophthalmoscopy, I can see the fundus, or I don't know if the same name, fondo de ojo, the macula, the relation between the vein and the artery. And in fact, we can see with the, con el fondo de ojo, we can see, in fact, pathology like dyslipidemias or problem with the thyroid or problem with the diabetes, in fact.
Okay, so you can make a differential diagnosis, right?
Yes, or complication that disease.
Perfect, Rina. Thank you. Someone else wants to add something?
Yeah, I would like to add something. Regarding a general eye examination, I would say that we also should evaluate the peripheral vision, because sometimes it might be like, for example, in a case of a pituitary tumor, we can see bitemporal hemianopia, and that's really important for the diagnosis. So peripheral vision is a must, I think, in a general examination of the eye.
Okay, thank you. Thank you, Jorge. Let's continue here. Well, Sergio, are you here? Can you read this part, please? Okay, I think we cannot listen to him. Weimar? Guys, do you listen to me?
Yeah, listen.
Yes, teacher.
Okay, thank you. Well, I will read it then. We have this pathology, retinopathy, okay? Is a hypertensive change, is when hypertensive changes in the retina and can be classified from grades 1 to 4. Okay, just to mention it. Grade 1 is silver wiring. That means increase in the light reflex of the arteries only. Okay, grade 2 is the same as grade 1 plus arteriovenous nipping or indentations of veins where they are crossed by arteries. We can find grade 3, that is the grade 2 plus flame-shaped hemorrhages and cotton wool exudate. Okay, and grade 4, it's the same as grade 3 class papilloedema. Okay, just to mention it.
Sorry, Mrs. Sinas, can you hear me now?
Yes, now listen to you.
Oh, sorry.
Okay, that's good. But you will read the next part.
Okay, that's fine.
Please. Let's go with the gastrointestinal system. Okay, can you read this part, please?
Yes, that's right. Examinations of the abdomen. Here's an extract from a textbook description of how to examine the abdomen. Note if the abdomen is descended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting the limbs. Percuss or tap first with the patient lying supine, flat on their back. Then ask the patient to lie on one side and percuss again. If fluid is present, the dull note heard on percussion moves. Palpate each region, feeling for tenderness, pain when touched, or massive, palpable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen for vowel sounds.
Okay, thank you, Sergio.
You're welcome.
Well, as you can see, we have this type of examination of the abdomen, right? I don't know if you are agree with this protocol, we can say, of examination, or you have another different way.
About the abdomen, we have a special order for the physics exam. In the abdomen, first is the inspection, second is the auscultation, third is the percus, and fourth the palpation. In other organs or in other parts of the body is other order. First inspection, second percus, third palpation, and fourth auscultation. But in the abdomen, the auscultation is second step.
Okay, thank you, Ale. And do you think this is missing something? Because I think it's one of the most common problems because why patients go to your consultation, right?
Yes.
Okay, so you want to add something else here, or you wanna take off something maybe that you think there is not needed?
The abdomen have the most organs in the body. It's really important have a good physics exam, but it's not easy. I don't know what. Sorry.
No, it's okay. Continue.
No, I don't know what can I say now.
No, it's okay. What about the other one? Is that good for you, or do you agree? Or maybe it's different in another country.
Well, it's the same examination because in this part that it's talk about the abdomen, the examination of the abdomen, but specifically because you first observe a present or fluid or gas. I mean, in the first moment that the part shows that the first thing or the first sign that you see is abdomen is an abdomen distended by fluid or gas. After that, you continue with the examination. And following that case, that is okay. And according with the partner told about the order of the examination, yes, it's okay. I think that this is the correct examination. I think there is no another change of the order when we talk about the abdomen. The order of the examination is observe the abdomen. After the second one is the auscultation. No, yes, the auscultation. The second palpation, and the last is percussion. But that is depend what is the problem with the patient, of course.
Okay, Lorena, thank you. Does anyone else wants to add something? Okay, let's continue then. Claudia. Oh no, Claudia's not here. Jocelyn. Are you here? Jorge, can you read this part, please?
Sure. Okay. The feces. There are several words for the feces. Doctors sometimes say there was blood in the stools. Have you passed black stools? Bowel movement is used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Patients sometimes say, my motions have been very loose lately. Bowel habits is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal?
Okay, thank you. So is there any other question that you can add here to know if there is something else in this part? Something else that you can ask to your patient to get a diagnosis? Is it okay if I ask to my patient if there was hemorrhage on their feces?
Yes, it is. Or maybe a change of color.
Okay. I don't know. Rina, maybe you want to say something else?
No, teacher, I want to say that I cannot understand the question. I can hear you.
Oh,
Could you
sorry.
repeat? Please.
Yes, I was saying if it's okay, if I ask my patient, maybe that if they were an hemorrhage when they went to the bathroom or on the faces. And Sergio says, yes. I don't know if there's any other question of it, or if this is very complete.
With the first one about the blood in the feces, probably another question useful will be the color of the blood. For example, bright red or rojo brillante or dark red, because that is depend. Yes, because that depends, or we give us an idea with the part of the what the part of the gastrointestinal system has probably the problem.
Okay, that's perfect. I'm gonna ask you for another ways to say it. Maybe your patient won't understand if you speak with so many technical words, right? But maybe if you speak to them in another ways, they will understand and give more information to you. So I need you to tell me if there is something else that you can ask to your patient for, in these cases. If there is not another way, it's okay. Can we continue, or do we have any other question?
Maybe you can ask about the feces, if the feces are solid or liquid.
Okay.
The structure, maybe. I'm not sure the word, but
yes,
if they're solid or liquid.
I think that will be really helpful to make a diagnosis, right? Perfect. Thank you. Weimar, are you here?
Hi, teacher.
Hi, Weimar. Can you read this part, please? Just the one that is up on the left side. Please.
Yes, teacher.
I'm sorry, Weimar, I cannot listen to you. Sergio, can you read this part? Weimar, I'm sorry, I cannot listen to you. I don't know if it's my internet. Can you listen to me again?
Yeah, we can hear you. If
Oh my
you
God,
if you
what is
want, I
happening?
can.
Thank you.
I can
Mateo,
read it for you.
can you read this part, please?
Okay. Change in bowel habit could be constipation, hard, infrequent stools or diarrhea, frequent soft or liquid stools. The color can vary from black due to altered blood, as in melena, to yellow, gray, or even white. Melena stools are often described as tarry, like tar, the black sticky substance that is used in the road making. The stools may be red when fresh blood is present. Blood that can only be detected with special tests is called fecal occult blood, FOB. When there is a high fat content, the stools are pale and are sometimes described as clay-colored. Stools that are large in volume are described as bulky. A bad smell is described as foul or offensive. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale. The scale is above.
Yes, thank you. Yes, we have the scale, right? Hard, formed, semi-formed, soft or loose, liquid or watery. That's what you were talking about in ballet, I think. Okay, you can say liquid or watery. Well, we have here some ways to describe the stools. Maybe when you have to write an evolution or something in the history, in the history of the patient, you will use these kind of things. It will be really helpful, okay? A change in bowel habit could be constipation, okay? It could be hard, infrequent stools, or diarrhea, that is frequent soft or liquid stools. The color can vary from black due to our altered blood, as in melena, okay, to yellow, gray, or even white. Melena stools are often described as tarry. What does it mean, tarry? Like tar, the black sticky substance that is used in road making, okay? And the stools may be red when fresh blood is present, blood that can only be detected with a special test that is called fecal occult blood, or FOB. When there is a high fat content, the stools are pale, okay, and are sometimes described as clay colored. Stools are large in volume and that are described as bulky. A bad smell is described as full of offense. And normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale, and we already saw this. Okay, let's continue. I don't know if we will have the chance to discuss our diseases. Okay, Jorge, no, sorry. Jethro, can you read this part? Can you explain to us?
Teacher? Yeah.
Can you read this part, please?
Yes, teacher. Gynecology, the female reproductive system, the womb, fallopian tube, ovary, neck of womb, and vagina.
Okay, thank you. Yes, we have the neck of womb or cervix, the vagina, the fallopian tube or salpinx, the womb, right? And the ovaries. Okay, Melanie, can you read this part, please?
Okay, Miss. Menstruation. A period is a common name for menstrual monthly period. The onset of menstruation is known as a menarche. The last menstrual period is commonly abbreviated in doctor's note LMP 2/15-2A, meant as the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually breathing in the form 4/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhagia, often with the passage of clots, coagulated blood. The term period pain means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climateric. In everyday English, it is known as the changed PF life, or simple the change. Symptoms of the menopause include hot flashes, sudden sensation of head, and night sweats.
Okay, thank you. Well, the menstrual cycle or length and frequency of periods is usually written in the form 4/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy period means excessive blood loss or menorrhagia. That is often with a passage of clots. Okay, and what does clots mean? A coagulated blood. The term period pains means dysmenorrhea or painful menstruation. Okay, the time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flashes that are sudden sensation of heat and night sweats. Okay. Is there any other symptom of menopause that you know and you cannot hear? Or maybe some sign?
Maybe gaining weight because of hormonal changes.
Okay. What else? Anyone else wants to add something? Weimar again, are you here? I don't know why I cannot listen to you. I'm sorry. No worries. I will tell another one, okay? Alejandra. And Alejandra is gonna be the patient and Mateo is gonna be the gynecologist, okay?
Okay. So are your periods regular?
Yes,
How often do you get them?
every 4 weeks.
How old were you when you started to get them?
About 12.
When was your last period?
A week ago.
How long do the periods last usually?
4 or 5 days.
Would you say they are light or heavy?
Light.
Do you get clots?
No,
Do you get period pains?
not really.
Is there any discharge between the periods?
A little.
What color is it?
White.
Okay, thank you. Is there any other question that we can make here? Or do you think this is very complete?
I think we
it's
could.
complete.
Okay, thank you, Rina. Mateo, do you want to say something else?
Yeah, I think we could ask further to evaluate the type or the characteristics of the discharge in this patient, like smell or consistency or
Okay.
I don't know, quantity of the discharge.
Okay, thank you. Anyone else? Okay, let's continue. Rina, can you read this part, please?
Yes. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, EUD, or copper coil. Condoms are available for both men and women.
Okay, thank you. The diaphragm, okay, and the intrauterine device, IUD, or copper coil. Condoms are available for both men and women. Do you think, which do you think is the most common one contraception device that is used in your countries, or that you can suggest to your patients?
Well, in my country, in El Salvador, it's common to use a condom for men, oral contraception, and the pills and the injection, yeah, the intrauterine device. And I don't know, there is another one, is los implantes. I don't know if that the image. Implants?
Implants.
But I suggest, because there are a little problems with the order that the women have to take the pills. I suggest injection and the intrauterine device.
Okay,
that is more secure.
Okay.
Yeah.
Okay, thank you so much. Well, while we are discussing this, just for a couple of minutes, I will send you my questionnaire. Please, can you fill it for me? I don't know if anyone else wants to add something.
Sorry, Mrs. Inas, I can't see the questionnaire.
Oh, no. Really? Okay. I will send you to your personal, okay? You will fill it there, and then you will send it back to me, okay?
Thank you, thank you, thank you.
Does anyone else can see my questionnaire? I need two more, please. Well, one more, since Sergio cannot fill it. Okay. I will take a little picture here and okay, thank you so much. We didn't have enough time to discuss what I told you last class, but we will make it on the next class, okay? Tomorrow, we are gonna start at 7. as always. Does anyone has any trouble with the schedule? No? Okay, I need to ask something for the replacement of the first practical class that we didn't have. Are you available for the next class after our theoretical class? Maybe we can make it 6 or 7 of you this next class, and on Monday we can make with the other half. What do you think?
Sure, I'm okay with that.
For me, it's okay also.
Okay, perfect. Let's talk on the chat and on the group, okay? Who can this next class and who can make it on, okay, who can make it on Monday? And we will discuss it then, okay? Thank you so much, guys. Have a great night and see you tomorrow.
Thank you,
Thank
Miss.
you. Good night.
Thank you.
Thank you.
See ya.
Bye.
Thank you.
See
Bye,
ya.
teacher.
Thank you. Bye,
Thank
everyone.
you. Take care. Sergio, stay here.
Yes. Yes, Mr. Singh. Okay.
Okay, do you have time to?
I don't. Sorry, Mrs. Sinas. Look,
Oh, no,
I can
no
show
worries.
you where I am right now.
No worries. Okay, so let's talk by the personal chat, okay?
Perfect. Thank you so much,
Okay.
Mrs. Sinas, and I'm sorry for the
No
inconvenience.
worries. No worries. Take care. Bye-bye.
Bye. Take care, Mrs.